Hey there. No, no, don't get up. Don't get up. You're totally fine. You stay right where you are if that's comfortable for you. Are you okay? Okay. Don't feel like you need to move. You don't need to move at this point. All right? It's nice to meet you. As you know, we are here today to go over your records. I see that you have had an injury. You were at work. Right. I have some notes here from the forms that you completed, but I would like you to tell me in your own words what happened and how long ago. Last week. Do you remember the day? Okay. All right. And you work for the factory. Okay. And do you know if this is going to be considered a workers' comp? It is. All right. Because I don't actually have that down on your paperwork. Let me see here. Okay, now we had the nurse came in and took you back for your x-ray. I have looked at that. We don't have any fractures. Nothing's broken, so that's good news. Let's see here. It looks like you've never been here before. It's your first time. Okay. Have you ever had an occasion in your life where you've used a chiropractor? Never. Okay. Well, that's understandable. There are a lot of people who do sustain injuries during playing sports, and that's how they become familiar with chiropractic. Okay, and you are. Okay, could you give me your date of birth, please? And your home address. Okay. And how long have you worked at the factory? All right, that looks good. It all matches up with what I have here. So for right now, I'm going to set your file aside. Now I want you to talk to me a little bit about your symptoms. Can you tell me what at this point is bothering you the most? Where is your pain the worst? That's okay. If you could just, that's okay. You don't have to point to it. If it hurts to reach around to your back, don't do that. I'm going to use my hand. I'm just going to use the flat part of my fingertips, and I'm going to put my hand. I'm not going to apply any pressure. I'm just going to place my hand on your back in different places, and I just want you to tell me when we get to a part that's tender or sore or just flat out painful. Okay? Now I'm going to reach around behind you. You don't need to move your arms. You don't need to move them at all. How about here? Okay, I'm going to move up a little bit. How about right here? Now I'm going to go over to your left a little bit. Do you have any pain on this side? A little bit. How about in the middle? Okay, right here. Okay, I'm not going to apply any pressure. I'm going to just make a note of that. So it's right in this area. And can you describe the pain for me? So it's really more of a dull ache. It's not a sharp shooting pain. Do you have any more areas on your right side? Just there. Now I'm going to come around. I'm going to use my right hand again. I'm going to use the flat part of my fingers right here, and I'm going to apply some other areas on your back. And I want you to tell me right here. Can you describe the pain right there? And here? Okay. And I'm going to come up a little bit. I'm going to come up just under your shoulder blade. How's that? So that's a sharp pain. Okay, that's interesting. But it's only under your left shoulder blade. Does it feel like it's kind of under the shoulder blade, or is it possibly the surface, under. All right. Okay, what I want you to do, if you can, if it's too painful, we won't do this. But what I would like for you to do, I would like you to raise your left arm up. You can keep your elbow bent if that makes it more comfortable for you, or you can straighten your arm, just whichever works for you. I would like for you to raise your left arm up as high as you can. And what I'm going to do while you do that, I'm going to just touch certain areas right up under your shoulder blade and also on top of your shoulder blade. I'm not going to apply any pressure at all. So, but I want you to tell me when I touch a place that causes pain of any sort, and then we'll discuss the kind of pain that you're having. Okay, go ahead. Do you think you can do that? You can, like I said, you can keep your elbow bent if that makes it more comfortable. It may not make any difference. Okay. Now, can you just hold it there for me for just a minute? I'm going to reach up under your arm. Right here. I'm touching right, and I'm not applying pressure, but I'm touching right under your shoulder blade. How's that? So the pain is definitely there. How about here? And here? Now I'm going to take my fingers and I'm going to just sort of touch. I'm going to kind of point at an area with my fingertips. I'm not going to push in. I'm not going to push down. I'm just going to kind of point at it. So you'll feel my fingertips, but they won't be pressing in. And right here. How is that? Is there any pain when I do this? Can you describe that? Okay, you can go ahead and put your arm down. That's fine. So it's more of that's a dull pain, like what you had in the middle of your back when I started over here on this side. So it's a dull. Would you say that it hurts more than the pain that we felt in the middle, or less, or about the same? About the same. Okay. On a scale of 1 to 10, would you say how would you rate the pain? And I'll tell you what I'm doing. Like, pretend this is your shoulder blade right here. So you're saying that we felt pain right here on the underside and kind of up around this part. Now this pain right here, would you describe that on a scale of 1 to 10? Would you say how bad is the pain? A 3. So it's not really bad. Is it? So you said that the pain in the middle was about the same. Okay, so that's about a 3 also. How about the pain directly under your shoulder blade? Wow, okay. A 7. Okay, well, we won't press on that anymore right now. I'm just trying to get a feel for what's going on back there. Now, if you don't mind, I know you have on your little hospital gown that opens in the back. I'm going to step around behind you and I'm going to take a look at this area. I'm mainly right now I'm looking for is swelling. We know there are no broken bones. We don't have any fractures or anything, so I'm not really checking for anything in that manner. I'm just looking really for swelling right now. That be all right? So you just stay still. If it's comfortable for you to sit this way, we will leave you there for right now. I will have to move you a bit in just a minute, but for right now, you can stay there if that's the most comfortable thing for you. Do you need a pillow or anything? If you had a pillow to place up under your arm, would that help? No? All right. Well, let me know if you change your mind. When I lay you back, I will have a pillow for your head for a portion of it, but not all of it. All right. So I'm going to come around back here, and I'm going to just take a little look, just a little visual. I'm going to pull the gown aside. I'm not going to take it off your shoulder. I'm not going to unbutton it. I'm just going to pull it over to the side a little bit. And feel right there. You do have some swelling. I'm not pressing hard. I'm not really applying any pressure. You do have some swelling definitely in the most painful section. There is mild swelling up on the side. And as a comparison, I'm going to feel your other shoulder blade. I'm going to just do a rough comparison with my hands, with my fingers. There's definitely some swelling, which is normal. Okay, now I'm going to fix your gown. And for now, I'm going to leave that like that. There is some swelling, but that's totally normal. When we are injured, our body's response is inflammation, and that's to help protect the injured area. Now, since this is your first time here, we're not going to do like a full physical or anything like that. Okay, that's not what we're going to do. But I would like to listen to your lungs and your chest, especially since you say that you have some pain around that shoulder blade. That concerns me a bit, and I just want to listen to your lungs. Okay, so what I'm going to do, I have my little stethoscope here, and I'm going to place it on your chest and your back in various places. I'm not going to press down. I'm going to try to avoid areas that you say are painful. I'm going to try not to apply the stethoscope there. But I do want to listen to your lungs. That's okay. We don't have to move the gown. It doesn't have to. We don't have to take it off or anything. So what I'd like you to do, if you can, does it hurt when you take a deep breath? Do you feel additional pain? You don't. Wonderful. I'm going to place the stethoscope on your chest right here. And if you would just breathe normally for a minute. You don't have to take a deep breath. Okay. I'm going to place it here. Just breathe normally. You don't have to. You just breathe like normal. Everybody says that. Everybody becomes very self-conscious of their breathing when I do this. It's okay. You're doing fine. And right here, I'm going to put it around on the side, just not really under your armpit, but kind of on the side down below. That's right. And breathe normally. And I'm going to bring around and put it on the other side. Okay, that sounds good. And now what I'm going to do, that sounds good. Now what I want to do, I'm going to come around to your back, and I will ask you to take some deep breaths. Now, if at any point you develop discomfort or pain, let me know, and we'll stop. All right? We don't need to move the gown. It's totally fine. Now, I'm going to ask you right here, do you feel the stethoscope? If you would please take a deep breath and hold it for just a minute and let it out. And again, take a deep breath and let it out. Take a deep breath and let it out. And again, take a deep breath and let it out. Okay, now that all sounds good. Your lungs sound clear. They sound great, which is good. I was checking partly for fluid on the lungs or any other, that I wanted to listen to your heartbeat. Let's see if that all sounds good. Any other irregular things. But everything sounds great. And except for the swelling, you look great. I know you don't feel great. Hopefully we can begin to help you with that today. Now you do understand with chiropractic care, we will not typically fix your problems in one visit. You will have to come back, and we will make adjustments. We will work with you on exercises and practices that you can use to strengthen your back and hopefully not only help it heal, but help prevent this from happening again in the future, which is what we really want. That's actually one of our big goals, is to prevent this from happening again. We don't want you to have to keep coming to see us. And especially since you've never used chiropractic before, hopefully this might be your only time that you ever have to. And I know you'd be happy about that. We have some people who are, for various reasons, just lifelong patients because they have a lot of different issues that they need to work on, and a lot of them never really resolve, so they have to keep coming back. But in your case, it sounds like if we can get you on a good program and get you to do some exercises and some other things, this might be the only time you really have to get to know us. So I think that would be good. Okay. Now, here's the part that most people don't enjoy at first. Hopefully, after we get started, you will find it a little better. I understand that I saw on your chart that it's uncomfortable for you to lie down. How have you been sleeping at night since your injury? In a recliner. Do you use pillows, or do you just get in the recliner? Are you able to lay it back yourself, like, pushing or pulling? You can. Great. So you don't need any help getting in and out of the chair? Usually not. The first night. All right. So you're not using any pillows behind your back or under your legs or anything like that for comfort? It's good just like it is. That's good. That's good. But what we're going to have to do now, I know you're comfortable sitting here on the edge of the exam table like this. I know it's comfortable for you. Unfortunately, for what I want you to do, that is actually not going to work. I'm going to lie you down on your back. I'm going to do this very slowly. I'm going to do it very carefully. Okay? All right. Now, if you would, please, I'm going to help you. I'm going to take my hands. I'm going to help guide you down onto the exam table. Wonderful. We're going to start by lowering you a little bit. Now, I'm going to turn you up. Now, you are at a bit of an angle, but that's deliberate, okay? This way I have a special table. This is not your typical exam table. This is one that I personally designed and have a pending patent on. And at this table, in case I don't know if you noticed, this table has a section that comes out. When I push a button, there is a portion of the table under your back which will collapse into the back of the table on an incline. So I can actually reach your back without you having to lie on your stomach, because I did see on your notes that you are having difficulty being on your stomach, which is one of the reasons why I had the nurse bring you into this exam room, so we could use my special table. Okay? Now what I'm going to do, you're good. Are you okay? Do you need any pillows at this point? Now I will have to take the pillows away if I give you pillows in a little bit, but not now. You good? I'm going to come around on the other side of the table where I can reach the left portion of your back a little better. So just stay there. Now, I want you to relax. I want you to completely relax as much as you can. Now, with this portion, we are beginning the adjustment section, the adjustment section, the portion of your visit here today. This will be at times uncomfortable, but it's usually short-lived. Usually the discomfort is quick, and after the discomfort, you're going to feel a lot better. Okay? I'm just going to try to adjust you a little bit more. We're still working out some of the bugs with this table. All right. I'm going to reach up under the table where it raises up. You will feel some pressure. You feel my hand just under your shoulder blade? Okay. If you would please, I have some grips right here on the side of the table. If you would hold this with your hand, and I would like you to use the grip during moments of discomfort to keep yourself steady. I need you to try not to move. I want you to be as still as possible. I'm going to take this hand and I'm going to place it on your belly to help. I'm just going to stabilize this portion of your back. I'm not going to press down, but I am going to keep my hand here to stabilize. Okay? Hold still. I'm going to get right here. Okay, good. How was that? How does it feel now? Yeah, certainly. Move your arm. Bring it out this way. Good. We're going to try it again. We're going to get you back upright shortly, and you can try that. Now I'm going to come around to that other part of your shoulder blade where you said you had the dull pain. I'm going to take my fingertips right here. You'll notice that these two fingers have short fingernails. There's a reason for that. I can work a little better without long fingernails on there. That's deliberate. And again, I'm going to use my left hand on your abdomen to stabilize you, just to hold you still. Some people actually are ticklish. One of the main reasons I do this is because people are ticklish and they squirm, they wiggle. All right, bring it up, and now I'm going to take these two fingers and I'm going to push in. That's right. Don't forget to breathe. I'm going to push in and pull. There. I'm going to let go. How's that? Excellent. I'm going to come around this side. Come right back around here. Now, the portion of the exam table that comes out allows me to reach the portion of your spine that you said had the dull pain. I am going to use my left hand this time. Just hold still. Do you need a break? Do you need to take a minute? You okay? I'm going to take my two fingers on either side. You will feel some pressure on either side of your backbone. You're going to feel some pressure. Now I need you to take a deep breath, okay? There. Did you feel that pop? Okay. I'm going to try again. I'm going to move my hands down a little lower. And again, I'm going to try that one more time. Just try to breathe normally. I'll give you a minute. I'm going to try that one more time. There we go. Did you feel that? I felt that it was a little slow, but it came. You felt that pop. Wonderful. I'm going to now take my hand and I'm going to massage that area on either side of your backbone. I'm not going to push down really hard. I'm not going to do anything awful. Just massaging it very gently. And what I'm doing right now, I'm actually feeling your vertebrae right in here, and I'm feeling a couple of these discs. Now with this one here, this disc, just pay attention to where I have my fingers right now. And this disc, does it hurt when I do this? Can you describe that pain for me? All right. We'll talk about that in a minute. I'm going to bring one more thing, and then I'm going to set you back up because I know this isn't comfortable. One more thing. I'm going to bring my hand up. Still working on your vertebrae. I'm going to bring my fingers up. And it's going to be some pressure. I'm going to put my hand here. And some pressure. There. That was a good one. That was good. Now you probably won't notice any difference in the way you feel right now while you're lying down, but we're going to set you back up. And we're going to set you up nice and slow. We're going to take our time. I'm going to put... That's okay, you stay there. I'm going to push this button. I'm going to put the center section back in the table. It just takes a moment. It operates with a little electric motor. It's kind of on this little track. It's a great idea. I got the idea when I had this one patient who was in a motorcycle accident, and he was in excruciating pain. He had some herniated discs in his back, And it hurt so bad for him to lie on his stomach that he just couldn't bear it. And I thought it would be wonderful. Now, he could lie on his back and it wasn't as painful. And I thought, let's start raising you up. I thought, wouldn't it be wonderful if we had some way that we could, that's right, nice and slow. There's no rush. Wouldn't it be great? Let's turn you back this way. Wouldn't it be wonderful if there was some way? I'm trying to get you back where you were. How's that? Is that about right? I thought it would be great, like I was saying, if I had a way to place patients so that they were comfortable, but I could also do what I needed to do. It would be beneficial for both of us, because it's much more difficult to work with someone who's in a great deal of pain, if you can imagine. I mean, I imagine it would be for me. If I'm in a lot of pain, it's going to be hard for me to be still and cooperative, especially with someone who is causing me even more pain, even though it's temporary. So that is when I came up with this design. And I have a design patent application right now that is pending with the patent office, which I'm very excited about. And it allows the patient to lie on their back when that's more comfortable. And I can still get to the areas that I need to get to. It doesn't work for every procedure, every alignment or adjustment that I need to do, but for a lot of them it does. So it spares a lot of people some pain. So I think it's a great thing. Now, just as you sit here now, you already look more comfortable. You're not as stiff as you were. How does it feel just to sit in the act of sitting up? And now sitting, you have your legs hanging off the exam table again. How does it feel now to sit up? That's good. Less pain is always good. So, I'm going to check the areas again that you said were bothering you before. Before I do that, I want you to again take your left arm, bend it if you need to, raise it up, and I'm going to just place the fingertip, the pads of my fingers on those troublesome areas on your shoulder blade. Right here. How's that feel? Better. And right here. How would you rate your pain? First, we'll start with that section under the shoulder blade. How's that? About a 2. Wow, that's a big difference. And on the side, a 1. Fabulous. Now I'm going to bring my hands around and I'm going to put them right along your backbone where we had the dull pain before. And you said it was about a 7. That's pretty severe. Now tell me, as I apply very light pressure on that spot, how does it feel? A 3. Not bad. So that's less than half. Less than half is bad. Excellent. Excellent. Now let me show you what we're dealing with your disc. I have a picture here that I want to show you. Okay. This, let me set your folder down. This is a picture of a normal disc right here. And what we have for you, and this actually is not related to your injury, and I'm going, when I make my report, I'm going to have to mention that you do have some disc degeneration in that area where you were injured. It is possible that the injury has aggravated it, which would explain why you haven't had any pain before now. But it is a degenerative disc right here. And you also have below that a herniated disc, which is just that was the part below where you were complaining about the most pain, the dull pain. That is a herniated disc, which is where some of the jelly in there kind of squishes out and it's no longer where it is supposed to be. Now that we can fix. The degeneration ultimately would have to be corrected with surgery, which we cannot handle here. but I would certainly be glad to write a report and speak with anyone if you do pursue surgery. I don't think at this point it would be necessary. It's not at an advanced stage at all. But I do want to make you aware of it, that you do have some disc degeneration going on back there. And my detailed report will have a lot more information, but I do want you to know about that. But see, with the herniated disc, when that jelly spills out, it can irritate the nerves around it, and it can cause pain, numbness, and tingling, and weakness that can go down into your arms and legs. Now, have you experienced any of that? I know it said on your chart that you have not, but I always like to ask the patient in person just to see if there's anything that they thought of after they completed the form. I know sometimes when we fill out forms, we just kind of go on autopilot and we don't always pay attention to what we put down. We just start checking off no boxes without really looking at them. So you haven't had any numbness or anything? Okay, well that's good. That's very good. So we did some slight adjustments today. The next time you come back, we may do some little more intense alignment and adjustment type things. But to start with, I wanted to just start very slowly. But I also want to talk to you about some things that you can be doing on your own between now and your next visit, which I would recommend coming back in a week at the latest, preferably sometime within the next, I'd say 4 or 5 days or so, if you can. That would be really good. A few things that you can do, very simple things that you can do to help. Drink lots of water. I know that and doctors say that about everything, I know, but it's very important here that you drink lots of water and stay hydrated. I don't mean coffee and soda, I mean actual water, because the water will help flush out the toxins and it will help your body repair itself. Another thing you can do is adjust your rear view mirror in your car when you get in. Especially a good time to do it would be right now, since we just did the alignment. When you go out to your car and you get in the car, notice how you sit. You're going to sit straighter. Your back will be straighter. Pay attention to where your rear view mirror is. Angle it so you can easily see out while you sit up straight. And from then on, when you get in the car, don't adjust the mirror, adjust your posture. This way the mirror will stay angled where you need it to be. And if you're sitting up straight, you'll be able to see out. So it will help maintain good posture. That's one thing you can do. Another thing you can do is take the wallet out of your pocket. I notice you have a wallet, and most men do. You have a wallet in your pocket. It's totally normal. Don't keep your wallet in your pocket anymore. You may not think about it, and it may not occur to you that it would do this, and it wouldn't to most people. When you sit on a wallet, especially a big thick wallet, it can sort of shift your posture. It's very slight, and it may not be a huge difference, but over time it can mess up the alignment of your spine, which is not a good thing for anyone. So it's really best to not keep your wallet in your pocket. Just keep it in your front pocket if you want to, or something, but try not to keep it in your back pocket, at least when you're sitting down. Maybe what a lot of people do, what a lot of my clients do, is when they're driving, they'll take it out of their back pocket and just set it in their lap. That way they don't go off and leave it in the car. If it's right there in your lap, you're going to see it when you get out, and then you can put it back in your pocket. But whenever you're sitting down, try to take the wallet and cell phone, even, if you have a cell phone in your pocket, take all that stuff out of your pockets. It's a good thing to do. Also, I want you, the nurse is going to give you a document that has a list of stretching exercises and strengthening exercises, not only for your back but for your abdomen, because to have a strong back, you really do need a strong abdomen. It will help keep everything lined up straight. So I want you to go over those exercises. If you have any questions about them, please give us a call. We'll be glad to help you out. If there are some that you are not sure how to do, we have a link on the bottom of that document to a YouTube video that we have created where we will show you a demonstration of each exercise. If you still need help, when you come back, we'll be glad to go over it in person. We can show you personally how to do it. But I want you to do those exercises every day. I want you to do it at least once a day. They're not. It doesn't take a long time, but I do want you to do that every day. If the pain is too much, give us a call. But I would think that most of these exercises and these stretches are things that you could do. You will have some mild discomfort, but I don't think it will be unbearable. But if it is, please give us a call, because that may mean that there's something else going on there that we need to deal with. So I think that will do it for now. I know that's a lot of information to take in all at once. And I understand that you are not working right now. Okay. And you brought in some paperwork for the workers' comp. We will fill that out for you. And when you come back, I will have that for you all ready to go with my letter and my detailed description of what we discussed and what we found today. And I think for now that's going to about do it. Do you have any questions for me? Okay. You know what? I would not recommend that right now. I think it would be a good idea to not try to mow your yard. Do you have a push mower? A riding mower? Actually, either one right now. I would avoid it if I were you. Get somebody else to take care of it, at least for a week or two. And especially after you've had time to come in and we've had time to do a few more adjustments. I would lay off on mowing the yard right now. Okay. Well, is anything else? No? Okay. Well, what we're gonna do, I'm gonna take you back up front, and we're going to give them your file, and we will go ahead and get another appointment set up for you so you can come back again. It was really nice to meet you, and I really hope that you have a wonderful rest of the day. Come on, I'll take you up front.